maybe
So
I will start. Sorry.
No, I don't think. Okay. This is a question regarding to Dr. Mose. It's regarding, you said that you are interested in overcoming the blood-brain barrier for brain tumor treatment. I wonder whether you think this is a fundamental barrier for this kind of disease, because there are many studies that show that the blood-brain barrier might be severely compromised in brain tumors.
Yes, our goal is not to worry too much about the EPR effect that may exist, although that's controversial in human glioblastoma. There are many cases that it isn't. It's still relatively tight. And as it was explained this morning, the glioblastoma tumor is not just a tumor. There are kind of like fingers. It's sitting all over the brain, and there the blood-brain barrier is as tight as everywhere else. So it is very difficult to get there. Our nanoparticles are small enough to not to worry too much about EPR. And the only problem with, as I told you, we probably go through a transcytotic way, is that we have to show that we're not losing the cargo by going through the cell layers. So if we look in the 3D model, we see that if you apply the nanoparticles on top on the endothelial cells, within minutes they are on the basal side, and a few minutes later you find them in the astrocytes below, crossing the interstitial layer in between. So there is movement of those nanoparticles, but we don't know if you put a chemotherapeutic substance on there that this is not lost during the transport. If you have a nanoparticle where the compound is attached via a gold-sulfur bond, inside the cells there's a lot of glutathione that normally will replace any molecule bound to gold. And we know that within 24 hours this happens, so that if you put a nanoparticle inside a cell, within 24 hours all the compounds that we put on there are replaced by glutathione. So that's the challenge. It's not only to getting across, but also to make sure that the cargo gets there where it should be.
Next question.
Hello. Is it? Okay. Do you have to do something? No. It sounds okay. Sorry. It's regarding to the absorption of the protein corona to the nanoparticles. You are studying the effect of the chemistry on the surface, but I suppose that the size is also affecting on the, if there is any steric effect of how or which kind of proteins can be absorbed, and if you have studied that effect as well, depending on the size and the chemistry.
No, we have not studied so far the effect of size, but from literature know that is also the size have an influence, yeah? And if you look on what happens with the nanoparticle, because the size influence also the electrolyte around. So we have another concentration of electrolyte if you have, for example, a smaller size or larger size, and this will also influence then the absorption of the protein, but we have not investigated this at the moment. So our particle have almost, let me say, between, with all the coatings, between 30 and 80 nanometers. So what is I have shown you is valid for this size range of particle.
More questions? And between the speakers? Okay, so I think we can slowly there is one more question.
I was going to ask something in the beginning.
Actually, I can do it afterwards. It's okay. Thanks.
So I think we have to look at the tremendous progress in the recent years to functionalize nanoparticles, and really to be able to decide how many molecules of which kinds are on the surface and so on, and also with the lipids technology. So it is very exciting what will happen soon. And I also would like to thank you very much to all the speakers and to the audience and to Priya for the very sympathetic and nice support, and to CLINAM and Beat Leffler for the excellent organization of all infrastructure problems and so on. Thank you very much for your attention.